determination of the concentration of blood urea nitrogen in serum or plasma is very important, most especially in the diagnosis and monitoring of renal function together with creatinine. In this video lecture, the clinical significance and reference range of the 5 significant NPN compounds will be presented. The learning outcomes are flashed on the current slide. What is the clinical significance of determining the presence of urea in the blood? An elevated concentration of urea in the blood is called azotemia. It involves excess nitrogen compounds such as urea in the blood, and in severe cases may adversely affect the kidneys and cause acute renal failure. Very high plasma urea concentration accompanied by renal failure is called uremia, or uremic syndrome as most nephrologists call it. Since uremia is a condition where there is a very high level of urea in the blood, accompanied by renal failure, where urea builds up in the body because the kidneys are unable to eliminate them. This can become a serious condition and likewise be life-threatening if not treated by dialysis or transplantation. It is usually accompanied by clinical signs and symptoms of renal failure, and uremia more commonly develops with chronic kidney disease, or CKD, especially on the later stages of CKD, but may also occur with acute kidney or renal failure. Dialysis is usually needed to relieve the symptoms of uremia until the normal kidney function can be restored. There are several types of azotemia, which are classified according to the area of the renal system that is affected. The pre-renal azotemia, which is typically caused by a decreased or lack of renal blood flow, less blood is delivered to the kidneys due to prolonged low blood pressure or irregular heart function, so less urea is filtered. This is the common cause of acute renal failure and can be corrected by returning normal blood flow to the kidneys. Renal azotemia is caused by renal failure, which can be seen in acute renal failure, which happens when your kidneys suddenly lose the ability to eliminate excess salts, fluids, and waste materials from the blood. This elimination is the core of your kidney's main function. Body fluids can rise to dangerous levels when kidneys lose their filtering ability. The condition will also cause electrolytes and waste material to accumulate in your body, which can also be life-threatening. Chronic renal failure or chronic kidney disease or CKD is a slow and progressive decline of kidney function. It means that the 3 major roles of the kidney, such as removing waste products from the body, keeping toxins from building up in the bloodstream, producing hormones that control other bodily functions, such as regulating blood pressure and producing red blood cells, regulating the levels of minerals or electrolytes, and fluids in the body, are not properly done by the kidney, so the elevation of urea in the blood is expected. Another renal cause of elevated urea is renal tubular necrosis. Inside your kidneys, there are small tube-shaped structures that remove salt, excess fluids, and waste products from your blood. When these tubules are damaged or destroyed, you develop acute tubular necrosis, which is a type of acute kidney injury. The damage may result in acute kidney failure. Postrenal azotemia is caused by a blockage in the kidneys that prevents the urine from being excreted from the renal system by renal and urethral calculi or stones, enlarged prostate gland, and presence of tumors in the bladder and prostate, as well as due to severe infections. So you might ask, is there a difference between uremia and azotemia? Yes, uremia and azotemia are 2 different types of kidney conditions. You acquire azotemia when your kidneys are no longer able to get rid of enough nitrogen waste, which are byproducts of nitrogen metabolism. That's why azotemia is characterized by an elevated level of urea in the blood, while uremia represents the entire condition and signs and symptoms of chronic renal failure. It is a toxic condition that involves a very high level of urea in the blood, accompanied by renal failure. Oftentimes, nephrologists refer to this as the uremic syndrome. The major causes of decreased plasma urea concentration include low protein intake and severe liver disease. Plasma urea concentration is also decreased during late pregnancy and infancy as a result of increased protein synthesis. The reference range for BUN are as follows. For healthy adults, the normal level for urea is 6 to 20 milligrams per deciliter. For healthy adults, the normal level for urea is 6 to 20 milligrams per deciliter or 2.1 to 7.1 millimoles per liter. While for elderly adults, aged 60 years old and above, the normal level is 8 to 23 milligrams per deciliter or 2.9 to 8.2 millimoles per liter. Patients with untreated end-stage renal disease, or ESRD, the reference range is 108 or 108 to 135 milligrams per deciliter or 40 to 50 millimoles per liter. BUN level for children and pregnant women is slightly lower, and usually male has higher BUN levels compared to women. The next presentation will be the continuation of the clinical significance and reference range of other remaining NPN compounds. If you have any questions or any thoughts regarding the topic, please feel free to post on the discussion forum provided in this module. Thank you so much and have a nice day.